how do you think would be best for patients to approach their doctors about looking into CVS?
You don't want to put the burden of everything on a patient to advocate for themselves, but this is one case where it actually really may help because cyclic vomiting, for what it's worth, is just not well recognized by most clinicians. So you might have a primary care doctor who's never even heard of cyclic vomiting syndrome, and bring some literature and say, hey, listen, I think I might have this. Like, what do you think? That starts a conversation. I don't think that's a very threatening way. I think most doctors are open to consider possibilities. So, but I think what's really key is to emphasize how episodic one's symptoms may be, because I think sometimes when patients talk to physicians, they say, I'm having all this nausea, vomiting, and maybe the clinician doesn't appreciate that this kind of has an ebb and flow, or that sometimes it's gone altogether, and focusing only on the attack may not give a great representation of how episodic it may actually be. So I think emphasizing that and say, hey, listen, I get these truly, it seems like episodes where like I get the attack and then it goes away. That would be the classic form. But I think that might help clue in a clinician that that's the right diagnosis. If it's unremitting nausea, vomiting every day, that's not CVS. So I think some clinicians may assume that it's every day when they're talking about symptoms or when they're hearing symptoms. So don't assume that your doctor can see everything that's happened about your care. Even if it's a large medical center, I can't see some of the things that happen to people in a center 5 miles away. So just journaling and keeping track of those could really help the conversation with your physician. That might help them help you.